Hi moms to be. We are pregnant in a time where there is so much of unpredictability and there's a lot of anxiety around us. So are there a few things that you can do to take care of yourself, especially with relation to the breath, if there's anything that you can do. So I thought there are a few techniques that pregnant women could use to really help themselves, calm themselves, and take care of your health. We are not just responsible for ourselves, but also for the little life that is inside us. So, a few tips, a few things that you can do using the breath to really calm yourself and take care of yourself. So, to begin with, you sit comfortably and easily. If you're sitting on a chair, make sure your feet are wide apart and your feet firmly planted on the floor. Your legs are apart and your feet are firmly planted on the floor. And sit with as much of a straight back as you can. Don't strain yourself, but sit comfortably. Now, in pregnancy, forceful exhalation is not recommended. So, we take normal breaths in and out breaths. If you do forceful exhalations, it increases something called apan vayu, or the downward movement of prana. This is something we need much closer to labor and much closer to due date. So anything that is forceful exhalation, don't do it. We'll use normal breaths and see how we can work with it. So a breath in activates the nervous system and the breath out relaxes the nervous system. So when we breathe in, when you take a deep breath in, do it with me. So you take a deep breath in, it energizes the body, and when you breathe out, it relaxes the body. So considering all the commotion that is going on around us and the constant talk of COVID and people getting affected, it kind of builds up a charge in the nervous system. So the point of controlled aware breaths is to be able to help the nervous system regulate itself. So the first technique that we're going to do is very simple. We take a normal inhalation but a really long exhalation, okay? And when you're doing this, you can choose to keep your hands on your belly. It will help you to connect with the baby also. Also, the mother's breathing is very important because energetically, the mother's mind connects to the baby's heart. So the more rested and relaxed you are, the better it is for the baby inside, okay? So what are we doing? We take a normal breath in, so breathe in. And exhale longer. So if you've breathed in for 4 to 6 counts, you breathe out for 8 to 10 counts. Again, breathe in. And breathe out. Breathe in. And breathe out. And continue. We don't hold the breath. We are not holding the breath. We are doing a gentle breath in and a breath out. We breathe in normally. We breathe out for as long as you can. You can choose to keep your palms on your belly. The second kind of breath that we can practice is a grounding breath. So here, you breathe in from your nose, and as you breathe out, you're consciously imagining that you're breathing out through your legs, out through your feet, deep into the ground. So it's a breath in, and as you breathe out, you're consciously breathing downwards. It's a very gentle breath. We are not holding the breath. We are not doing forceful breathing. Okay? And you do it for as long as you can, whatever is comfortable for you. So let's breathe in. And breathe out. Breathe in upwards. Breathe out with awareness into your feet and the ground. Once again, breathe in upwards. And you breathe out consciously into your feet and into the ground. So in my case, I'm doing breathing in 5 and breathing out 10. You can do as much as is comfortable. There are no specific counts. Okay. The idea is when you breathe out, you're consciously breathing out through your feet into the ground. So breathing in, you inhale upwards. As you breathe out, you exhale downwards and inwards into the earth. This also you can do with your hand on your belly. Remember to keep your legs apart and your feet firmly on the floor, because this will really help you to calm down and it will bring a very nice sense of relaxation. We are not holding the breath, it's gentle breaths in and out. The third kind of breathing can be done with the movement of the arms. So you don't have to, if you don't feel like keeping your hands on your belly, you can just move your arms. This is also a movement of Qigong, which is a slow movement meditation. It's a more oriental practice, but it's a very nice technique and it really helps to unwind and loosen up. So breathing in, raise your arms up. As long as you can, and breathing out, arms down the midline. Palms facing the floor. Again, breathe in. And breathe out down the midline. Once again, breathe in. And breathing out down the midline. You can move the toes of your feet in between just to get a feel of your feet on the floor. But this can be done both standing and sitting. I'm saying sitting because this is for pregnant women. It's nice to sit comfortably with your feet firmly on the floor. So this is the next technique that you can do. You can repeat this 4 to 8 times. Any of the techniques in this video can be repeated 4 to 8 times, any number of times in a day. There is no limitation. The fourth technique that you can do is called alternative nostril breathing or Nadi Shodhan Pranayam. Now the left and the right half of the bodies are indicative of specific areas of the nervous system. The idea is to balance it, regulate it, therefore balance your breath and your state of mind. So the left palm goes into Chin Mudra. It is the thumb touching the index finger, not too tight. A strand of hair should be able to pass between these two fingers, and this palm goes on your knees facing the ceiling. With the right hand, the thumb goes on the right nostril, index and middle fingers where the bindi is, and the ring finger and the small finger on the left nostril. The idea is you breathe in from one nostril, breathe out of the other, breathe in from the same nostril and breathe out of the other. Okay, so I'll take you through it. You can do this with me or you can see how I do it and then you can do it by yourself. Okay, so index and middle fingers in the middle of the eyebrows, thumb on the right nostril, index and small fingers, ring and small fingers on the left nostril. Now you close the right nostril with your thumb, Breathe in from your left. Breathe out of your right. Breathe in from your left. Breathe out of your left. Now breathe in from the left. Close the left. Open the right. Breathe out of the right. Breathe in from the right. Close the right. Breathe out of the left. Breathe in from the left. Close the left. Breathe out of the right. Breathe in from the right. Close the right. Breathe out of your left. Let's do one last round. Breathe in from the left. Close the left. Breathe out of the right. Breathe in from the right. Close the right and breathe out of your left. And slowly relax. You may feel like closing your eyes, which is absolutely fine. In fact, it is recommended. All that you have to remember is whichever nostril you breathe out of, the following in-breath is from the same nostril. You breathe out of the opposite. Again, you breathe in from the same, breathe out of the opposite. So it's alternate nostril breathing. It's called Nadi Shodhan Pranayam. It is tremendously beneficial to calm the nervous system down. It's tremendously beneficial to feel very balanced and very, very peaceful. The next technique that you can do is called Bhramari Pranayam or the bumblebee breathing. You know how the bumblebees go bzzz. So Bhramari is like that, but we don't do bzzz. We basically make a humming sound, sound. So what we're going to do is we're going to use the index fingers, and you know there is the lid to the ears. It's called the tragus. So what we'll do is we're basically going to plug the lid to the ears. You're going to breathe in. Close the ears and breathe out, making the humming sound. Once again, breathe in. Let's do once again. Breathe in. And relax. When you're breathing out and making the humming sound, you can also choose to slowly move the lid of the ears, but it's not mandatory. This can be done 6 to 8 times, 4 to 5 times, whatever works for you, especially in times when you're feeling anxious or uncomfortable, or for some reason not very settled. In fact, this pranayam is so powerful, it helps to settle the baby also. So if you feel that the baby is being very restless, you can just do Bhramari, and both of you are going to find your sync and both of you are going to calm down. The next technique is called the Bhuga breathing. So Bhuga breathing was developed by an osteopath called Dr. Leon Chateau. It's a very beautiful breath and it is designed to open the rib cage. So we have a breathing muscle called the diaphragm, which basically runs below the rib cage. And for us as pregnant women, the belly is a little full. There's an actual living being inside. So releasing the diaphragm directly becomes very difficult. What we can instead do is, we can use the shoulders to open and therefore opening the sides of the rib cage, and as you breathe out, letting go. So Bhuga breathing is done by, again, your legs wide apart, feet firmly on the floor, arms to your side, palms facing forwards. Okay, so your palms are facing forwards. I'm going to sit on the side and show it to you. So you're sitting comfortably, palms are facing forwards. Now what we will do is, when you're breathing in, the palms rotate backwards and you straighten your spine and look up. As you breathe out, the palms are coming forwards, you're sitting straight and you're letting go. Okay, so let's do this together. Feet apart, legs apart, feet firmly on the floor, palms to the side. Breathe in, open your chest, turn your palms backwards, look up, arch your back a little, and breathe out. And relax. We're not slouching, we're coming back to the straight position. Again, breathing in, arms rotate backwards, palms facing the back wall, back arching just a little, chin going up, you're looking at the ceiling, and breathing out. And sitting straight. Once again, breathe in, arms rotating backwards, palms facing the wall behind you. Breathe in. And as you breathe out, arms coming back, palms facing you, relaxing your shoulders, relaxing your chest and sitting straight. Bigger breathing can be done 5 to 6 times. Remember to keep your legs apart, feet firmly on the floor. This is going to give the stability to be able to make this movement. And the last and one of the most important things that you need to do as a pregnant mom is to meditate. So meditation takes you in a deep state of consciousness where a lot of things come back to physiologically normal. A lot of things in the body come back to normal levels. Meditation doesn't just help to calm the mind, it also changes the body physiologically towards health. Because of underlying short-term stress, it's very common for mothers to get very activated, become restless in their sleep, worry a lot. And as expecting mothers, we are already very sensitive to the environment around us. And there is a very strong charge at the moment. So meditations like Sahaj Samadhi, which is very simple. Sahaj means very simple. Samadhi is a very deep state of consciousness. So Sahaj Samadhi meditation is a meditation which is very simple to do, yet very powerful. And it's just about 20 minutes, but it gives you rest that is equivalent to about 4 hours of sleep. So Sahaj Samadhi meditation. You can also do Yog Nidra. Yog Nidra is yogic awareness towards different areas of the body. This can be done lying down towards the left side, and that can really help bring awareness to different parts of the body and really help the body to calm down. You can also do other guided meditations. You will find the links to a few of those meditations in the description of the video. And if you would like to try them, I would highly recommend you do. Meditation for a pregnant mother once or twice a day is very, very good. Not only for the mom, but also for the baby. As your mind calms down, your body becomes healthier, your blood levels improve, and you generally become very peaceful and very rested. That is the most important thing in pregnancy, to feel deeply rested, to be aware yet calm and composed. So I hope you like the techniques that I shared with you. If there's anything else you would like me to talk about, or if there's anything else you would like me to make a video on, please drop it in the comments. Take care of yourselves. We are responsible not just for ourselves, but also a little one inside. So we're responsible for 2 precious lives. Stay settled, stay grounded, take care of yourselves, breathe as much as you can, move as much as you can. Wishing you a very happy pregnancy and a very safe birth.